Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, this is the visual pathway. In the visual pathway, first the from the nasal part of the retina. So this is the nasal part of the retina. So this is the nasal part of the visual field and this is the temporal part of the visual field. Always the nasal part of visual field is projected onto the temporal part of retina, whereas the temporal part of visual field is projected onto the nasal part of retina. So both these will, so the nasal part is projected to the temporal part of retina, whereas temporal eye field visual field is projected to the nasal part of retina. Now both the nasal parts of the optic disc, so both these are the nasal parts of the optic disc, they cross with each other, whereas temporal parts will continue as it is, and then the both of them will reach the lateral geniculate body. So from there is loop of Archambault is present, which is called as Mayer's loop, and then it goes through the optic radiation to area 17. Now if there is a block in the optic nerve, so this is optic nerve, so this is called as optic nerve, this crossing is called as optic chiasma, this tract is optic tract. Optic tract contains the uh, temporal part of the optic nerve of ipsilaterally and nasal part of the optic nerve contralaterally, and then this optic tract will go to the lateral geniculate body and from there it goes to the optic radiation. Now if there is a lesion in the optic nerve, that means this whole eye cannot see, so there is total blindness of the ipsilateral eye is seen if there is a lesion in the optic nerve. Second, if there is lesion in the anterior chiasma, so this is chiasma, if there is lesion in the optic chiasma, that means the this part, that is the nasal part of both the eye fields are lost. So if nasal part of both the retina, actually nasal part of retina is lost, that means temporal eye fields are lost. So here this is temporal eye fields are lost, vision in the temporal eye field are lost, so there is bitemporal heteronemus hemianopia is present. Second, anterior junction syndrome. In anterior junction syndrome is also called as junctional scotoma of Pacquard, which is present here. So this will here in anterior junctional syndrome, there is one special syndrome which is called as anterior junctional syndrome, or which is also called as junctional scotoma of Lacquer. Here the lesion is actually present at the junction of the optic chiasma along with the optic nerve. So that means if these are the crossing of nasal retina and this is the temporal retina, now this anterior junction syndrome is present here. So it is actually present at the junction of the chiasma and the optic nerve. So here there is the okay. So it is present somewhere here between the chiasma and the optic nerve, somewhere in the middle um, there is a lesion. So here the patient will present with, there will be a ipsilateral central scotoma will be present, along with that contralateral superiotemporal quadrantanopia is seen. So this will result in ipsilateral scotoma along with superiolateral quadrantanopia is seen in a patient with this junctional scotoma of Pacquard. Then, if there is a lesion in the optic tract, if there is a lesion in the optic tract, that means ipsilaterally the temporal retina is lost, and contralaterally also temporal retina is lost. That means there is loss of, right here it is not given in the question, so that means here there will be loss of something like this. So here ipsilateral, uh, so if we see here for this one we will see, that will be better. Okay, if you see here ipsilateral temporal field is lost, so there will be loss in the nasal field like this. And here there is ipsilateral contralateral nasal field is lost, that is there is loss in the temporal field is present. So this is actually homonymous hemianopia is seen in these patients with optic tract anomaly. Then we have lesion at the um, here that is either at lateral geniculate body, the lesion is at the lateral geniculate body. Then you see contralateral homonymous hemianopia, because even here there is loss of this nasal part of the contralateral retina, whereas in the ipsilateral eye temporal part is lost. So obviously the ipsilateral nasal field and contralateral temporal field is lost, causing contralateral homonymous hemianopia. Then we have issues in the optic radiation. So whenever there is issue in the optic radiation, so if there is issue in the temporal radiations, sorry, first if there is an issue in the parietal radiations, okay, parietal optic radiations will result in contralateral lower quadrantanopia, whereas temporal radiation lesions, these will result in contralateral upper quadrantanopia. Then there is also contralateral homonymous hemianopia with macular staging is seen if the lesion is in the occipital cortex involving the occlusion of the posterior cerebral artery, involving the occlusion of posterior cerebral artery. If the lesion is in the optic occipital cortex, then we see contralateral homonymous hemianopia with macular sparing.
Thank you and thank you for watching.